Okay, this is my rehearsal speech for my demonstrative speech, and my anticipated audience will be Columbia Gas and Transmission for the pipeliner workers about heat exhaustion. And first I want to start the introduction by introducing myself and my topic and asking the audience if they had ever experienced heat exhaustion before with themselves or anybody else, and then ask them if they have any questions that they want to go over or anything specific that they want to talk about regarding heat exhaustion. And then I want to go over the facts of heat exhaustion. The body can cool itself down by sweating and then having the sweat evaporate from the body through the pores. And then that happens when there is enough fluid in the body to make the sweat, and then having the air circulating the body's skin and the low humidity that allows the sweat to escape. And activity in a hot environment can cause the body to be overwhelmed and not be able to cool itself down the way it's supposed to, and then that's what causes the heat-related illnesses. And symptoms of heat exhaustion include profuse sweating, weakness, nausea, vomiting, headache, lightheadedness, and sometimes even muscle cramps. And heat exhaustion can progress into heat stroke, and when that happens, the body's temperature regulation completely fails, and then heat stroke is a life-threatening situation. And there's different symptoms that you can watch for and know if you're experiencing heat exhaustion before it goes into heat stroke. And knowing what to look for and seeing the symptoms in other people, then you can help them and notice and treat their symptoms before it gets worse. And then next I want to go over what you do if you or someone's experiencing heat exhaustion and how to treat the symptoms. And then the first thing is to recognize the symptoms before they go too far. And then now I want to ask the audience if they remember any of the symptoms of heat exhaustion that I listed before. And then after that I will explain to them what to do if they are experiencing heat exhaustion. And the first thing you want to do is get out of the heat into a building with air conditioning so you can rest, or if you can't get to a building, to get to a shady place, just anywhere that's outside of the heat. And then you should definitely drink plenty of water, because drinking water can make your body more hydrated from all the sweat that you've lost, so you don't dehydrate. And you should not drink soda or alcohol. That would make the situation worse, and there's caffeine and that can make you more dehydrated. You should drink water because water helps the most. You can also take a cool bath or a cool shower, or just apply cool water to your skin and let your body cool down. Then you can also take off any loose or unnecessary clothing that could also be making you hot. And then if you or anyone you're helping doesn't feel better within about 30 minutes of those symptoms, then you should definitely call for extra help before the situation gets worse and can go into heat exhaustion or heat stroke. And the most important thing with heat exhaustion is to recognize the symptoms so you can treat them before it goes into heat stroke, because heat stroke is life-threatening. So I want to explain what to do if it does go into heat stroke and how you can help that person and what to do for them or yourself. And the very first thing to do is to call 911 immediately, and then there are some things you can do while you're waiting for help, because you can't treat heat stroke by yourself. And then while you are waiting for the help, you should move that person to a cooler place only if you think you can without hurting yourself or them. And if they are conscious and okay, you can place them in a bath as long as you can consistently watch them in a cool bath, and that could help calm them or cool them down. And also you can just use lukewarm water on their skin and then use a fan to kind of dry that off, and then that'll help cool the body down as well. And then also it's important to give them any cold beverages, especially water, to keep them hydrated as long as they're in a normal state and can handle drinking. It's just important to ask them if they can handle it and just try to judge if they could or not. And then in conclusion, I want to ask if everybody has understood my speech, and if they had any further questions about heat exhaustion or heat stroke, or if they'd want me to go over anything again. Just make sure that they understand the signs of heat exhaustion and they know what to do and how to help someone or themselves who might be in danger of heat exhaustion or heat stroke.